Okay, so for action and uses of medicine, 100 level second semester, we have introduction, definition of medicine and drugs. Medicines are substances that are used to diagnose, treat, and prevent illness. So a medicine is supposed to have beneficial effect or therapeutic effect. A drug, in contrast to a medicine, can have a positive effect or negative effect on a patient. So, for example, heroin is a drug in that it's a substance that can cause a specific biological effect. But heroin is not categorized as a substance that prevents, alleviates, or cures a symptom, ailment, or disease state. So we can conclusively say that all medicines are drugs, whereas not all drugs are medicines. So the drugs for therapeutic purposes, the drugs that are used for diseases, are called medicines. So for the fate of medicine, in pharmacology, anytime we say the fate of medicine, we are referring strictly to the pharmacokinetic parameters, the absorption, the distribution, the receptor affinity, which is a pharmacodynamic parameter, the metabolism, and excretion. So what is pharmacokinetics? Pharmacokinetics is the time course of drug absorption, bioavailability, distribution, metabolism, and excretion. A general definition is that pharmacokinetics is what the body does to the drug. You must take note of this. Pharmacokinetics is what the body does to the drug. So what does the body do to the drug? The body makes the drug, the body absorbs the drug into the systemic circulation. The body distributes the drug to several body tissues. The body breaks down the drug, which is metabolism. The body metabolizes the drug, and the body eliminates the drug. The body excretes the drug. So pharmacokinetics also describes, excuse me, the movement of drug into, through, and out of the body. So pharmacokinetics is strictly about the fate of medicines. So let's take the parameters one after the other. Absorption. Absorption is defined as the process by which the drug moves from the site of administration to the systemic circulation. So the site of administration can be the gastrointestinal tract. It could be the muscles in case of intramuscular ingestion. So the process by which a drug moves from this site of administration into the bloodstream is what we refer to as the absorption, or into the systemic circulation. So if you give a drug intravenously, it does not have to move into the systemic circulation because you are already administering it directly into the systemic circulation. So drugs that are administered intravenously do not undergo absorption for this reason. Now, distribution is the reversible movement of drug to and from the systemic circulation. And it's usually carried in the blood or plasma. So once the drug leaves the systemic circulation and does not return back to the systemic circulation, that drug has undergone elimination. The drug has undergone elimination. Excuse me. So what is elimination? Elimination is the irreversible rather, loss of drug from the systemic circulation. And when we say the systemic circulation, we are talking about the blood. We can also say the serum or the plasma. They are quite synonymous. When we say the blood consists of the plasma and the blood cells, okay? While the serum is the plasma from which clotting factors have been removed. That's what the serum is, okay? So now, elimination of drugs can be divided into two. We have metabolism and excretion. So elimination is the umbrella word for metabolism and excretion. So let's talk about metabolism. What is metabolism all about? See, metabolism is the process of the conversion of a drug into a different chemical species. So the drug, let's take for instance, the drug is a particular certain molecule or chemical. So metabolism is the process by which this drug now changes from this molecule into another molecule. Is somewhat is something we can describe as maybe a chemical reaction. Okay, so and the essence of converting the this drug into another chemical species, okay, is to ensure that the drug can be excreted because most drugs are lipophilic in nature. So, and you know, drugs are majorly excreted by the kidneys, and the kidneys hold water and urea or urine, which is majorly water. Okay, so um, the metabolism has to take place so that the drug will be rendered more hydrophilic and it will be easy for excretion to take place. Okay, so um, so when a drug is being converted from one molecule into another molecule, we call this new molecule the metabolites. Okay, so the metabolites will possess little or none of the activity of the parent drug. In the case of prodrug, in fact, the metabolite will be more active than the prodrug. So, well, you don't need this. This is just showing us that there are some drugs that have therapeutically active metabolites. It will not come out in your exam. So, what is excretion? Excretion is the irreversible loss of drug, either in a chemically unchanged or metabolite form. Okay, so here, this is what we are saying. So we are saying that a drug may be excreted. There are some drugs that are excreted unchanged, meaning that they are excreted, they have not undergone metabolism, but they are excreted out of the body. Then there are also some drugs that are excreted in the metabolite form. This means that the drug has undergone a chemical change or a change from one chemical entity into another chemical entity, then is excreted out of the body. Now, the two principal organs responsible for drug elimination, note, this word elimination means metabolism and excretion, are the kidney and the liver, okay? Now, the kidney is the primary site for removal of a drug in a chemically unaltered or unchanged form, excretion. Okay, it also removes metabolite too. Then the liver is the primary organ where drug metabolism takes place. Okay, the lungs occasionally may be an important route of elimination for substances with high vapor pressure, like alcohol and gaseous anesthetics. If someone takes alcohol, you know that it's easy for you to perceive that this person has taken alcohol, particularly when you move close, because alcohol has high vapor pressure and it can go out through the breath. Okay. Now, so uh, other routes of drug elimination. Some drugs are excreted in feces via the gastrointestinal tract. So, and this usually occurs through the process of biliary excretion, okay, where drugs are eliminated in bile and then passed into the intestines. If you watch the video on the digestive system, we said that the liver produces the bile from the breakdown of worn out red blood cells, okay, or hemoglobin. Then the bile goes through the biliary duct into the gallbladder where it is stored. Okay, so some drugs are excreted, move from the liver into the gastrointestinal tract, particularly the duodenum, with the bile. Okay, so in some cases, the drug can be absorbed back into the bloodstream from the intestines before they are eliminated. The skin also can help us eliminate some drug. So drug can leave the body in small amount via sweat and sebaceous glands. However, this is not a major route of drug elimination. If you see when some people take drugs, it smells from their body. It smells in their sweat. That's because that drug can be eliminated via the skin, via the sweat. The saliva too, some drugs may be excreted in saliva and they can also be swallowed back because you swallow your saliva and they get eliminated through the gastrointestinal tract. Some drugs can be eliminated into breast milk in nursing mothers, and these can be ingested when the infant um, feed or is being breastfed. So this can have implications for the breastfeeding mother, and some drugs should be avoided, okay, during lactation. Now, some drugs can also be eliminated through the exocrine glands, such as the lacrimal gland, resulting in drug elimination through tears or the mammary glands, the breast. Now, sources of medicine is another topic we have to look at in the introduction or the introductory part of AUM. Now, broadly, drugs can be sourced from natural means, semi-synthetic means, or synthetic means. So the natural sources of drugs are plants, animals, minerals, microorganisms. Then semi-synthetic drugs are obtained from the natural sources and are later chemically modified. Okay, so while synthetic drugs are produced through chemical synthesis in the laboratories. Okay, so now let's pick them one after the other. Drugs for natural sources, number one, plant. We have some drugs that are chemically classified as alkaloids. Morphine, atropine, quinine, reserpine, ephedrine, um, vinblastine, and vincristine. Okay, so morphine is derived from the opium poppy, Papaver somniferum, and morphine is a potent analgesic. Okay, atropine is derived from the nightshade plant, deadly nightshade plant called Atropa belladonna, and atropine dilates the pupils. Is also an antidote for certain poisonings. Okay, now quinine is obtained from the bark of cinchona tree, and quinine has been historically used to treat malaria. Its derivative, chloroquine, is also used for malaria prevention and treatment. Okay, so there are other ones that are mentioned here: reserpine from Rauwolfia serpentina. Okay, we have ephedrine from Ephedra seneca. Then we have the anti-cancer, vinblastine and vincristine from the Madagascar periwinkle, Catharanthus osseus, and these are anti-cancer agents. They are drugs employed in cancer therapy. Then we also have glycosides, particularly cardiac glycoside like digoxin, digitoxin, that are used for heart failure These days, the use of cardiac glycosides has reduced. They are no longer used as before. Okay, so except in heart failure with atrial fibrillation. All right. Now, artemisinin, our popular anti-malaria, was derived from the wormwood plant Artemisia annua. Okay, so we also have drugs coming from animals, like in the case of insulin. Insulin initially was extracted from the pancreas of pigs and cattle. Don't forget that the pancreas, the beta cells of the pancreas, produce insulin both in humans and in animals. So, however, the insulins we now use are no longer derived from animal, but from recombinant DNA technology. Although the use of animal or microorganism is still involved, sort of, we have heparin from the liver and lung tissues of pigs. We have exenatide. This exenatide is a medication used to treat type 2 diabetes. Uh, and it was found in the saliva of Gila monster, a venomous lizard. Enalapril was originally derived from the venom of the Brazilian pit viper, a snake. And enalapril is an angiotensin converting enzyme inhibitor used to treat hypertension and heart failure. Okay. We also have drugs from minerals like ferrous sulfate, magnesium sulfate, zinc sulfate. We have drugs from microorganisms like penicillin, streptomycin, griseofulvin. Then we have semi-synthetic drugs like hydromorphone, hydrocodone, okay? And synthetic drugs, there are quite a number of them, aspirin, paracetamol, so, like we said, in the case of insulin, drugs can also be produced by genetic engineering, DNA recombinant technology, e.g., in the case of the hormone insulin, the hormone growth hormone, and hepatitis B vaccine. The next thing to talk about are the branches of pharmacology. Okay. Now, there are quite a number of branches of pharmacology. We have pharmacokinetics. We have talked about pharmacokinetics. We said it is what the body does to the drug. Then pharmacodynamics is what the drug does to the body. And this describes the mechanism of action of the drug at the molecular level, cellular level. Okay. Now, therapeutics. Therapeutics is the branch of pharmacology that is concerned with the treatment and management of diseases. Okay. Why chemotherapy refers to the treatment of diseases by chemicals that kill cells. So especially those of microorganisms and cancer cells. Okay. So of microorganisms and cancer cells. So chemotherapy can be classified into two divisions. We have antibiotics. This includes drugs that are used for gram-positive and gram-negative organisms for bacteria and all, fungi and all. Then we have anti-cancer drugs. Example is methotrexate. And we have the vinca alkaloids, the vincristine, the vinblastine, and so. We also have toxicology. And toxicology is the branch of pharmacology which includes the study of adverse effects. That is what toxicology is about. It deals with the symptoms, the mechanism, the treatment, and detection of poisoning or adverse effect caused by different chemical substances. When it comes to toxicology, the main criterion is the dose. Paracelsus, a scientist, said all drugs are poisons. The dose is what determines if a drug is a poison or not. So essentially, medicines are poisons in high doses, and some poisons are essential medicines in low doses. Some drugs can cause toxic effects in low doses, while some drugs can be toxic in high doses. Clinical pharmacology is the scientific study of drugs in man, okay? And it includes pharmacokinetics, pharmacodynamic investigation in healthy human beings, okay? Now, what is pharmacy? Pharmacy is the art and science of compounding or dispensing drugs. Pharmacognosy is the aspect of pharmacology or pharmacy that deals with drugs in crude or unprepared form, particularly drugs from natural sources like plants. Okay. Now, pharmacogenetics is the branch of pharmacology that deals with the impact of genetic variations in responses to drugs. Okay. Um, when this Take, for instance, two people can take the same drug and react differently based on their genetic makeup. This is what we are saying here, all right? So we're saying that when genetic variations among humans influence effect or side effect, then that aspect of pharmacology is pharmacogenetics, okay? There are quite a number of other branches that I don't think we need to talk about them. So let's go into, because they hardly come out, okay? So let's go into terms in pharmacology. We have dose. So what is dose? Dose is the amount of drug needed at a particular time. That's the definition of dose. It is the amount of drug needed at a particular time. So take, for instance, if we have the star PCM, 500 milligram TDS by 3 over 7. Okay. So what is the dose in this prescription? The dose here is 500 milligram. That's the dose, because that is what is needed at a particular time. Let me correct this, because this is not a standard adult dose. Okay. So let's get this corrected. So let's say the standard adult dose is 1 gram. Okay. Now, so here, the dose, the drug needed at a particular time here is 1 gram. So that's the dose. Okay. Now, so the next thing we need to define from the course outline is the dosage form. The dosage form is the form in which a drug is presented for use. So we can have suspension, we can have, let's still take a look at paracetamol, for example. Paracetamol can be presented as tablet, okay, or caplet, okay. Then it can be presented as suspension for pediatrics, for babies. Okay. Now it can be presented as emulsion in injectables. Okay. All right. In various forms like that. So this is the form in which a drug is presented for use is called the dosage form. So what is drug interactions? You see, when two or more drugs are used at the same time, because drugs are chemicals, there is a tendency that there will be an interaction between them. Now, so this interaction can now be categorized into four. We have the additive, okay? This additive occurs when the combined effect of two or more drugs is equal to the sum of the effects of each drug. So when drug A has effect of 2 and drug B has effect of 2, and you use the two together, and the effect you get is 4. That's what we call the additive effect. For synergism, when the effect of the drug is 2, of drug A is 2, and the effect of drug B is 2, and you use them together and it gives you 10, then you say the effect is synergistic, okay? Because the combined effect, this is combined, not the combined effect of the two drugs is greater than the sum of their individual effect. So potentiation is when drug A does not have effect, drug B has effect 2, but you get 4 effect higher than the sum of the two, but one drug does not have effect. So it can only enhance the effect of the other drug or potentiate the effect of the other drug. So antagonism is when we have drug A has effect, drug B has effect, but the combined effect you get, uh, the effect is lesser than the sum of the individual drugs. Okay, so we can also have what we call the cumulative effect. This cumulative effect is the condition in which the repeated administration, the cumulative effect is the condition in which the repeated administration of the drug may produce more pronounced effect than those produced by the first dose. So what we are saying here is that when you keep using the same drug for a very long time, there may be accumulation of the drug or its metabolite in your body, which will also then lead to a cumulative effect. Okay. So now let's talk about drug abuse. Okay, so excuse me. Now, so that's cumulative effect. So what is drug abuse? Drug abuse is the use of a medication without a prescription in a way other than as prescribed, or for the experience or feelings elicited. So when a drug is taken recreationally, okay, recreationally to feel high, and this is when we can be talking about drug abuse. Take, for instance, the abuse of opioids, when you take stimulants, okay, just for the euphoric effect, then we are talking about drug abuse. Drug misuse, however, may be that you are using a drug and you are not following medication instructions. Okay? Now, drug misuse may include the incorrect dose, taking a dose at the wrong time, forgetting to take a dose, or stopping medicines too soon. Okay? You might be taking anti-malaria, which you should take for 3 days, but you have decided to take it for 1 day and you stopped. So that will amount to drug misuse. So contraindication, okay? Contraindication is a condition, that would make the use of a drug harmful. Okay, that's what we call contraindication. Okay, it means that a generally accepted procedure or treatment is contraindicated when there is a special aspect of the patient's condition that predicts harm, okay, or renders an unfavorable outcome. So, take for instance, we used to say that NSAIDs are contraindicated in asthma, okay, because of a common pathway of prostaglandin inhibition that may upregulate the triggers of asthma. Okay, so the condition in a contraindication is a condition in which the use of a drug might become harmful or might give unfavorable outcome. Tolerance. Tolerance is the diminished effect or sensitivity to a drug resulting from previous exposure to that drug or a related drug. Okay. It's like very close to tachyphylaxis. Okay. But for tachyphylaxis, it's a little different because here, what changes is the maximal response and not the sensitivity to the drug, but they are quite synonymous. Okay? So tachyphylaxis is progressive diminution of response to frequently repeated doses. So let's talk about substance abuse, also known as or substance dependence, okay, also known as drug dependence. So in dependence, what we have is that uh, it is an adaptive state that develops from repeated drug administration, and it usually results in withdrawal upon cessation of the drug. So when we say there's dependence, the hallmark of drug dependence is withdrawal symptom or withdrawal syndrome. So if you say this person is now dependent on this drug, it means that the person, if you try to make this person discontinue the usage of that drug, the person will show withdrawal symptoms. Okay. Now, withdrawal symptoms, take for instance, could be um, agitation, sweating profusely, and all. Okay, so drug addiction. What is drug addiction? It is the compulsive use, out of control use of a drug despite negative consequences. That's addiction. Dependence is that when they are trying to wean you off the drug, trying to make you stop the use of the drug, you show withdrawal symptom, okay, which will make you also seek for the drug, okay. But why drug addiction is, the drug may have been that may have already started damaging the body, like a liver damage, but you are still hooked on the drug. So that's drug addiction, despite negative consequences. So addiction is most closely associated with, okay. So all these, there are some substances of abuse like caffeine, alcohol, cannabis, opioids, sedative, hypnotics, stimulants, tobacco, your cigarettes, and some other ones. Okay, so we still have quite a number of things to talk about few of them. Drug hypersensitivity. Drug hypersensitivity. This is an immune-mediated reaction to a drug. Okay, and symptoms can range from severe to mild to severe, rather, and it can include rash, anaphylaxis, and serum sickness. Okay, so it's usually immune mediated. There is a difference between drug hypersensitivity and drug sensitivity. Drug sensitivity is usually not immune mediated. It's just an idiosyncratic reaction, and it does not involve the immune system or the release of histamine. Okay, but whereas drug hypersensitivity involves the immune system, is immune mediated. Okay, so that's the difference. And the treatment for drug hypersensitivity is that you discontinue the drug that has caused that hypersensitivity, then you give supportive treatment like antihistamine, promethazine, hydrocortisone, and all. The next terminology we talk about is side effects. Side effect is any effect of drug, whether therapeutic or adverse, that is secondary to the one intended. So you are using drug for an effect you want. That's the intended effect. Let's take, for instance, you are using NSAID for pain. The intended effect is the relief of pain. Okay. Now, but this drug can also irritate your GIT. So this is an adverse effect, and it can be regarded to as side effect. Now, side effect can be beneficial, okay, but it can also be harmful. When it is harmful, we say side effect, adverse effect rather. Okay, take for instance, let me give you a beneficial effect. If you are taking for chlorpheniramine, Piriton, for allergy, a side effect is drowsiness or slight sedation. Okay, so this may be beneficial, particularly if you need to sleep. Okay, all right. Now, so this is the describes the probability or chance of experiencing. If a side effect is common, that means greater than 1 out of 10 patients will experience it. Just take note of this frequency. It may not really come out in the exam, and that's why I hesitated early to, okay. So adverse effect is undesired harmful effect. Undesired harmful effect. You know, we say side effects can be beneficial too, but adverse effect is undesired harmful effect. So this adverse effect can occur at clinical normal dose. Let me use that term, normal dose, and it can also occur on overdose. When it occurs on overdose, we usually use the word toxic effect. Okay. Now, but you see, there's another term, adverse drug reaction. And this adverse drug reaction refers to unwanted or undesirable effect of a medication that occurs at the usual clinical dose. Then it's often exaggerated. Is often maybe serious or severe. Okay. We have talked about contraindications earlier, and we said that contraindications, they are symptoms or conditions that makes a particular treatment or procedure inadvisable. Now, so another term is antagonism. What is antagonism? Antagonism is when a drug blocks or reduces the effectiveness of another drug. That's what we refer to as antagonism. A receptor antagonist, okay, is a type of receptor ligand that blocks the biological response by binding to and blocking the receptor. It does not activate it. You see, receptor ligands in pharmacology, there are two types. You have agonist. Agonist will bind to the receptor, activate it, and cause an effect. But antagonist will bind to the receptor, it will not activate it to prevent the agonist from binding, and an effect will be produced. There's also a term called resistance, which is the development. This particularly happens in microorganisms and tumor cell in chemotherapy. So it's the development of the ability to withstand the previously destructive effect of a drug, either by microorganisms or by tumor cells. Thank you.